Okay, hi, how are you? This is Andrew Lau, Low Tea President. I know we're going to have a webinar coming very exciting. Coming down is, at 11 o'clock. We're going to have a lot of people from all over the world, people from Hawaii, people from Hong Kong, people from quite a bit other places. Matter of fact, we already see some people already from Hawaii joining us. And also I noticed some people from Singapore is joining us and Hong Kong joining us. So it's going to be an exciting thing. Today we have a very, very good webinar about COVID-19 because it's really a hot topic nowadays because the United States is very, very exploded with COVID-19. Actually all over the world, including Hong Kong. Even, you notice in Hong Kong, Yamada is kind of place where people actually now they're talking about lock up in the whole community. So that is really a big thing. So anyway, we're going to talk a lot about that today. And I hope that this was going to be a very, very good discussion to pick up some new knowledge. And actually, I talked to quite a bit of professor friends, and they all think that actually that will be really helpful to at least continue add on to the knowledge on preventing COVID-19 on diabetic。各位朋友，我係 Andrew Lau 老師 D President 你好。今日咧其實一個好好嘅 topic 嚟，點解咧？因為其實咧冠狀病毒咧，其實依家咧係喺好多地方都係有好大問題。咁其實我哋係點樣能夠令到呢啲問題咧係更加係幫到你唔會 infected 感染到呢個冠狀病毒咧，呢個係一個十分重要嘅話題。咁今日咧我哋係會特別咧係 spend 多啲時間咧講下呢樣嘢，咁令到你哋咧能夠係更加多了解，咁你就可能夠咧防禦呢樣嘢。其實咧冠狀病毒咧會係跟住我哋 for 一段好長好長嘅時間。個原因咧就係我同教授講咗㗎啦，咁我話喂係咪會即係2-3個月又會停㗎啦？如果打咗防疫針啊，或者係會唔會係降低呢樣嘢㗎？咁其實咧就唔係嘅，原來咧現在嚟講，佢就係打防疫針咧都有好大段時間先能夠即係呢啲防疫會係更加唔會真係令到好多人病啦，同埋打防疫針嘅時候咧。呢啲防疫針係可以 last 你幾耐咧，係仲未有人知道。咁所以變咗嚟講咧，呢樣嘢咧一路落去嘅時候咧，係真係有好多問號喺度啦。同埋咧 most 嚟咧，如果係嘅話出現咧，你都係一樣要繼續打呢個防呢個冠狀病毒嘅防疫針啦，或者係你哋要繼續即係戴口罩啦嚇，咁呢個係我哋即係一路落去都係會係咁嘅。咁其實我哋今日咧好高興咧，有好多朋友啦，依家有好多喺夏威夷嚟嘅朋友啦，亦都有好多係喺新加坡嚟嘅朋友、澳洲朋友啦、香港朋友啦，一路咁慢慢加入嚟嘅。So today was very nice. We have quite a bit of different people come all over the world, including people from Hawaii, people from Hong Kong, people from California. I noticed now there's some coming from California. Also, we have a lot of people from Singapore and also some, I think there's some from Malaysia, Australia, and Philippines. So a lot of people are coming in. So, this is really going to be a very, very good, program that we all have everybody to start off. So anyway, just want to let you know that we are going to talk about it. If you have any question, do ask because it's going to be an extremely good webinar to let people discuss. And I had actually asked a lot of professors in Hong Kong, what is going to be up future, and they all told me that, hey, this is not going to go away real fast. And that's something that you got to keep that in mind. 冠狀病毒咧，其實咧我問咗好多教授㗎啦，即係瑪麗醫院嘅教授啦、香港大學教授啦，同埋威爾斯王子嘅教授啦。咁其實佢都話咧，其實咧冠狀病毒真係唔會話咁快嘣一聲3-4個月就走咗去，即係其實由依家起到年尾出年咧，你都係一定要戴口罩。 因為最好咧戴口罩係防禦咗你係感染嘅。咁依家我再講係仲有咩能夠可以更加好嘅防禦啦？因為如果唔係咧，你係真係即係要係辛苦嘅，因為咧好多人咧就有時係美國嘅朋友咧就覺得話 I'm tired of it， 即係我話美國朋友話我太攰啦，呢個觀眾又好似我哋即係又冇得去街，又冇得食飯，依家閂佢閂埋嗱，真係要 patient 啲。但係有好多方法咧，令到你能夠更加開心嘅。點解咧？其實咧就係好多方法，就係用翻我哋網上嘅溝通啦，好似我哋用咗 WhatsApp 溝通啦，或者我哋出街行下個 park 啦。去即係啲冇人行乜滯嘅夜晚嘅 shopping mall 行下啦。You know, actually we have a lot of the discussion now. People say, I'm so tired of my, COVID-19 infection. I cannot go, I cannot have dinner, all the restaurants close at 6 o'clock, and I cannot eat in a restaurant and just even be there, So I guess, we are frustrated, but you got to be a little patient. One thing is important is keep the sort of the social contact. Don't isolate yourself, because if you isolate yourself, you can be really trouble. And I have already experienced some friends start getting very depressed in the home because they all locked out too long. And especially the elderly, I noticed, and this is reported to some of the elderly center, because they cannot go to elderly center now. So the elderly are locked in home and they have very little contact. So they start getting confused. They start asking, questions that, where is this? Am I, belong to this group? Where's all my friends? Things like that. And many of them start getting depressed. And that is even more problem, because if you're getting depressed, you know what's going to happen? You're going to be not asking questions. You're going to isolate yourself. You don't even want to listen to music anymore. You're going to sleep all the time. And these are the things that my elderly center nurse is reporting back to me. This is the kind of problem they see now in the elderly center people who didn't, go to the center. They have to lock out in the home. 嗱，其實我哋有好多朋友咧，其實就係呢個已經係嗰啲叫老人中心啦。咁個 nurse 咧就話俾我聽咧，佢話：哇！依家我哋好多老人中心好有問題嘅，啲咩問題啊？咁佢話第一咧，嗰啲老人中心咧，個問題咧就係佢哋 end up 咧係好多咧就係唔可以出街啦。咁開始咧有個 depression。咁呢老人中心咧個 depression 呢啲人咧冇人同佢傾偈，仔女可能要翻工。咁啊冇得呢個工作嘅東西 ，so 佢哋變咗嚟講咧，真係會係好多時候咧就 end up 咧就會係有個depression， 咁真係好弊喎呢樣嘢。咁呢個咧我覺得係好慘嘅，所以其實咧我覺得係真係要咧同佢哋傾下偈啦，帶佢行下街，但係就唔係行啲好多人嘅街。要行啲街咧係少人啲嘅。So really at the end of the day, the elderly people, really many of them are actually depressed. So you got to take them out to parks where you have distance and so forth. So, we will be, sharing more idea with you guys later on. And so we'll go from there. Now, 好多謝咧，好多朋友咧已經係一路逐步咁落嚟啦。有好多個喺香港啦，加州啦，又都有澳洲啦，有夏威夷啦，有新加坡啦，越整越多人嚟啦，咁好開心今日會係 share 呢樣嘢。So I will start my webinar now because we have a lot of people already signed in, and then we have people from all over the place, quite a few people from California. We have people from Hong Kong. We have people from Hawaii. Quite a few people from Hawaii. Matter of fact, Los Angeles. Also from Singapore, Malaysia, and Australia. So the cloud is getting bigger and bigger. I'm sure there are more and more people coming. So it's okay. We will be here. and continue to talk. And then if they come in, we'll just join us. So I'm going to put on my slides, and then we'll go from there. I'll come up with the slides coming here first. Okay, if everybody see my screen and able to see me, maybe you can give me a 1 and also give me a 1 and also can hear me, tell me, give me a 2. Okay, you can hear me, give me a 2. Okay， 各位朋友，如果你聽到我講咧，就俾個1我啦，或者俾個2我。Okay, everybody seems to be good. Can hear me and talk about. Okay, I'm going to start off now. This is COVID-19 infection prevention tips for diabetic. And on top of that, we're going to have a bonus webinar talk about how to get cauliflower mash. I think you will love this because this is something really can help you to lower your carb and really have something extremely delicious and is really, really cool. Okay, 各位朋友，今日咧我哋講係冠狀病毒點能夠令到你咧係唔會有感染到啦。咁呢個係一個 tip for 我哋嘅前期患病者或者糖友。咁仲有咧 after 咗之後咧，我再整一個椰菜花嘅 mash， 係會令到你覺得十分好食嘅。咁我哋而家開始啦。嗱，因為我有好多糖朋友啦，係新嚟㗎啦。咁我繼續都要講幫助佢俾大約3分鐘講我即係糖尿病嘅重點。其實咧好重要咧，糖尿病咧係 affect 你成個身體嘅血管嘅。咁如果你糖繼續高落去嘅時候咧，你血管咧就會繼續係損壞。咁呢個損壞咧係令到你咧係成身嘅所有嘅你所有裏邊成身體嘅任何一笪地方嘅 organ 咧都會影響到嘅。所以其實好重要咧，你一定繼續去控制你血糖，同埋咧你唔會有好多不同嘅即係嚴重嘅併發症。嗱，前期患病者同糖尿患病者都係一式一樣，因為3年後咧，如果前期患病者你唔控制血糖咧，你就轉咗糖尿病。咁同埋咧好重要咧，就一定要你個好嘅 diet 啦，或者 exercise 啦，仲有控制啦，你個磅重啦。同埋你知道點你個血糖係點樣，咁呢樣嘢咧係好重要嘅。咁當然啦，如果喺大裏咧，你一定飲下去糖茶啦，係真係會幫助你降低血糖啦，唔好飲汽水啦，同埋呢啲嘢。咁呢個係一個好重要嘅東西嘅。咁飲去糖茶仲有唔可以講咧，仲可以降低血糖，仲有 detox 同埋降低你膽固醇。咁我哋有一堂咧，下一次咧係3月6號係講嗰個膽固醇同埋你個糖。成個整體嘅情況係點做出嚟嘅？呢個係一個好好嘅 lecture 3月啊。Okay, so I just want to make sure I catch up with everybody who has not attended our webinar, and basically I need to share with them really high blood sugar will affect the entire body, and they will have tremendous amount of complication that will be occur to them if they don't control their blood sugar. For pre-diabetic, in 3 years they will convert. And there will be tremendous amount of health issue. And the way that you got to do it, you have to think about dieting, exercise, weight control, and then control diet. You have to measure your blood sugar and then listen to many of our lecture to get yourself aware because it's a lifelong disease. Certainly drinking low sugar tea is really to help, and low sugar tea actually lower your blood sugar and cholesterol. Certainly no longer have to really the drink of high carbs soda. So you really have to think about that. And we can talk a lot about that, and you can ask a lot of questions about how to diet and so forth. So this is just to catch up with all the people coming new and don't know us, okay? So we need to do that. And how low sugar tea work is very simple. Basically, low sugar tea have two items. One is called guava leaves, which will block the sugar going to the vessels, and then the bitter melon take the sugar into the cell. That's how it works. Very simple. And it proven to be work with patient study, and it does, and also it does lower your cholesterol. Now, if you not handle this, you know what will happen? It affect your heart, vision, kidney disease, stroke, nerve damage, and poor circulation. You will actually end up cutting your foot, and that is really going to be sad. Where I'm an ICU nurse, and I saw a lot of people actually had, you know, very bad diabetes that they will actually end up to the hospital. That would be really not good. So this is the kind of potential complication will be with high blood sugar. So you really need to think about that to prevent getting to that stage. 嗱，記住，因為你嘅糖繼續高嘅時候咧，就影響好多樣嘢，影響你嘅所有血管啦。咁呢個帶動咗咧，就影響你嘅心臟啦、你嘅腎啦，腎會可能要洗腎啦，因為依家75%嘅腎病洗腎病人都係糖尿病病者啊。咁有中風啦，同埋仲有好多係神經嘅系統損壞啦。仲有如果你血液循環係尤其是喺腳底下嗰啲唔好咧，個損壞咗唔好咧，你就 end up 就要割咗個腳啦。咁其實我哋有好多堂咧都講咗呢樣嘢嘅。咁我哋繼續落去咧，亦都繼續講好多不同嘅病咧，亦都係糖尿帶出嚟嘅。咁一路你繼續了解咧，你繼續多啲話原來真係 control 個糖好緊要嘅。OK， 咁今日咧就講正題啦。我哋係點去防禦呢個 COVID-19？ So now we'll talk about really our key topic. How a diabetic patient control your COVID-19 infection? Now, as you know, many diabetic patients has a higher risk to develop complication and even death. And actually, Hong Kong is reported in the very early days, a lot of these COVID-19 infected person, even as young as 39 years old, and they got infected, you know what? They died, okay? So diabetic, the reason is because they have high blood sugar, which is called hyperglycemia, and that definitely had impaired the immune system. So net result, they actually get less immunity to fight for the virus. Plus, they already have all kind of issue with the vessels, blood vessel. So death is much higher risk. Okay， 嗱，聽住咧就係因為記唔記得我哋開始有冠狀病毒嘅時候咧，好多感染者咧係39歲都死咗，記唔記得？咁嗰陣時嗰啲人咧，原來佢哋全部咧係已經有糖尿嘅患病者嚟嘅。點解咁咧？就因為佢哋嘅血糖好高。嗱，血糖高咧就影響咗佢全部嘅抵抗力啊，咁個感染性就高咗好多咧。咁中咗招之後咧，佢個患病率就高好多，同埋亦都佢嗰個病情咧亦都好深重好重嘅。咁就好多時咧就 end up 就會死亡。如果唔係死亡咧，佢或者嗰個創傷咧亦都更加深。You know, people over 60 years old, and we saw many of those now who are under some kind of high pressure, high blood sugar, heart disease, especially obesity, you know, they are very overweight, or some kind of respiratory patients, or cancer. All these are really high risk of COVID-19, and they get usually very sick. And they can usually, because they are 60 years old already, any of these especially with respiratory problem, they tend to be so sick they have to intubate it. So net result, the death is actually very high. Now, let me report, in Wuhan, they have something like 7,000 people, 7,000 patients in earlier day. And they look at that, and these 7,000 people, the people without diabetes, they tend to get well. But on the other hand, people who have diabetes, 11 death rate was 11% was the death rate for this group of people. So in a way, if you are diabetes, you actually have a higher chance of death rate. And what it means diabetes or higher blood sugar. These people are the blood sugar with 180 milligram per dil or 10 mmol per liter. So in other words, if the blood sugars are continued to be 10, they tend to have a much more death rate, as much as high as 11%. Now this is in Wuhan. I think in US is very similar. And in French hospital, who over 65%, the diabetic, if they 10% who is diabetic admitted to the hospital, and within 10 days, many of these people are died. So really, the death rate are much higher in diabetic than actually non-diabetic person. And because none of these people are, if they are overweight and so forth, they will tend to have lots of additional problem, especially if BMI is over 40. They even have a big problem, heart problem, could be respiratory problem. So that is something that right now the patient study actually showed the death rate are much higher. 嗱，我哋亦都睇到咧，係喺好多人咧，如果65歲後咧，如果佢有糖尿病嘅，或者有 cancer 嘅，有血壓高嘅，佢有肥胖嘅，有心臟病，其實死亡率係高嘅。咁仲有咧，我哋喺武漢睇到咧，有7000幾個病人裏邊咧，如果佢係冇糖尿病嘅，其實佢哋嘅死亡率咧就可能夠低，同埋咧佢係可能夠可以全面出院。但係如果佢係有糖尿病，個 death rate 係11%，咁亦都喺法國咧，喺啲糖尿病病者10% 入咗去醫院裏邊咧，差唔多10日之後咧，佢就會死亡。所以其實咧，好多人咧原來了解到咧，如果你真係糖尿病病者，喺香港都見到啦，初期嘅糖尿病病者嘅人咧，全部都係即係死亡初期嗰班咧，都係有糖尿病嘅。所以變咗嚟講咧，真係有糖尿病係令到你嗰個 risk 係高好多嘅。咁尤其是咧肥胖嘅人，亦都係有呢個問題。如果有 BMI over 40嗰個咧，係一定亦都有嗰個問題嘅。咁其實咧，普通嘅即係常見我哋嘅冠狀病毒裏邊咧，係佢哋常見嘅症狀係咩咧 ？So what is the common COVID-19 people see their symptom? What are the symptoms? Now, majority of them, many of them, actually 40% have no symptom. So that is kind of scary. But if they have symptom, they usually look like a flu. They have fever, they get tired, they got dry cough, they aches and pain, nasal digestion, runny nose, sore throat, loss of taste and smell. Some of them have skin rash, and also some of the discolored toe, and they have diarrhea. And I found that I talked to many of our doctors in Hong Kong. They said many of them do have fever, tired, just like cold. But one of the more prominent, they always lost the taste and smell, and sore throat, and also some of them have diarrhea. So this is very common. But the scary part is 40% have no symptom. 嗱，常見嘅症狀係咩咧？佢會發燒，就覺得好攰啦，好似有 flu 咁啦，即係感冒咁，又有咳啦，同埋成身痛啦，仲有鼻塞啦，又或者流鼻水啦，喉嚨痛啦，咁仲有咧就冇咗呢個味覺啊，咁有啲有 skin rash 啦，即係個皮膚疹啦，咁同埋有啲就手腳咧就嗰啲顏色唔正仔啦，仲有肚餓嘅 fever 係高嘅，即係多數好多人有發燒嘅，亦都有攰啦，同埋有身體好似感冒咁痛啦，同埋有喉嚨痛啦，但係多數好多亦都有一個咧就係冇咗個味覺。即係感覺唔到好似冇咗味覺咁喎，咁同埋咧有肚瀉，咁呢啲係好 common 症狀，但係好特別咧就好有40% 人冇症狀。咁如果冇症狀嘅時候咧，你 walking around 你已經 infect 咗喎，咁啊一樣繼續去俾人其他傳染人哋。So it really important is when you have no infection, you didn't know what you happened. So what happened is you are continuing spreading the virus if you do not wear a mask. So wearing a mask is extremely important. So whenever you feel you're sick and then you have difficulty breathing, like shortness of breath, and then you have persistent chest pain, especially chest pain radiate to the right, right shoulder, left arm coming up, especially left arm coming up, not right shoulder, left. There's a typo there. And then you are confused. You can stay awake, or you really your face, lips become bluish color. You really gotta go to hospital. The reason is because at the end of the day, you end up really basically difficult breathing is a very bad sign, maybe because of the fact that your O2 saturation is low, and you have pain, chest pain on the left side. Basically, you have actually, your basically is because of your potential heart attack. So those are the signs that is no good, especially you're confused and you cannot stay awake, and your face becomes bluish because of air. When your face becomes bluish and lip becomes bluish, that's mean your air exchange is very poor. So when you have some serious condition, you got to go to hospital.嗱，記住，當你有嚴重病嘅情況，個面同埋你身體上嘅東西係令到你覺得，咦，我真係開始好病咧，你就快啲去醫院。咁呢啲係咩情況咧？就譬如我唞氣好困難嗱，因為咧冠狀病咧係 affect 你個肺嘅，你個肺啊兩個肺都係 affect 到嘅。咁呢個肺 affect 到嘅時候咧，可能好多有 pneumonia 啦，咁你令到肺咧個 gas exchange 唔 good 啦，即係氣exchange 唔 good 啦，咁你咧就要好困難去唞氣嘅，咁你就即係你係好辛苦，亦都冇晒力，同埋咧，如果你係有心臟病，令到你心臟病嘅話咧，咁你係喺個左邊個胸會痛，亦都 radiate 上你個膊頭嗰度。就唔係話你腰因為我攰啊，咪唔舒服啊，呢度會好痛嘅。咁呢個咧你就真係要快去睇醫生啦，或者去醫院啦。咁同埋咧，可能咧亦都起唔到身，亦都個面咧開始變咗藍藍地色，同埋咧唇咧你個口唇亦都藍嘅，即係話咧你個 gas exchange 好差。所以 O2 saturation 咧係會令到你啲嘢即係你個氧啊。喺個血力係唔夠咧，咁你呢個咧係一定係嚴重嘅病啦。咁你就真係要去快脆咧，係去醫院睇咧，係咪有呢個任何嘅問題？by the way，我哋想喺個 Facebook 嗰度咧，如果你聽到我講嘢咧，你可唔可以俾個 like 我啊？因為我唔知你 Facebook 聽唔聽到啊，唔好意思啊，我照要睇嚟先。So anybody in Facebook see my slides, can you give me a like so at least I know you are there, you can hear me, or give me a like would be good. So can you do that? Just want to say to the group. I presume you can hear me, okay, over there. So now, really at the end of the day, World Health Organization gave a very good guideline to how to prevent your infected with your COVID-19. So you really got to follow this, and I would go through all that with you, and you need to continue to do that, okay? So Well Health basically is that you really have to wear a mask covering your nose and mouth when you go outside, especially around people who are not living with you, is not in the same household. Now, do not wear a mask with your nose exposed. You have to wear over it and also cover this really, really well. It covers everything because air will drop in. You want to make sure you don't go out. You don't want to be infected if you have it, or you don't want to basically getting yourself infected by others coming through with all the holes, or except over here, your nose are not covered, you're infected. You can be potential cross yourself contaminated. You also need to wear eye shield in a crowded bus or airplane. What is eye shield? It's a face shield or eye. The reason is because in a crowded area, especially, you cannot have the distance. The problem is whatever the virus go around can actually contaminate with the eye. On top of that, when you have eye shield, the chances of you yourself using your hand touching your eye are much more difficulty. The problem is a lot of people don't realize when you infected most is not really just by breathing, is your dirty hand touching your eye, touching your face, and then later on you contaminate with the nose, and you got it after that. So this is the two things we have to talk about first. And then third thing, the most important is washing hand with hot disinfectant soap. And then that would take at least 20 seconds to wash your hand, using alcohol to sterilize all the time, because you always carry a small little bottle of one of these disinfectant. And you have to make a habit, continue to do that. If I touch a metal piece, I will actually wash my hand with one of this little bottle. So I would just refill it over and over again. So I will always keep my hand washed all the time. 嗱，世衛咧係講得好清楚嘅。第一，你一定要戴咩啊？口罩 ，OK？ 嗱，你戴口罩咧係幫助你係唔俾你去傳染人哋，亦都人哋可以唔會傳染你。戴口罩咧就一定係 cover 晒成個面啦、鼻啦同埋口啦，就唔好話戴口罩嚟到呢一度個鼻突咗出嚟，咁其實咧就弊家伙啦。其實你係出去話俾人聽，你俾啲菌我啦，咁就唔正嘅，一定要戴佢全面戴晒佢，咁你就 OK 嘅。咁仲有咧，你如果係喺啲好多人嘅地方，好似一個巴士啊、飛機啊，咁你其實咧最好咧就戴埋個面罩。依家面罩咧係一個咁樣嘅 shield 咧，嗱有好處嘅面罩底下咧你就戴呢個mask 啦，因為戴面罩嘅時候咧個 chance 咧你係或者你手鬥你眼係唔會咁多啦，因為你已經有個口罩面罩罩住啦。第二樣嘢，如果有一啲好近嘅 virus 飛下咧，亦都去唔到你眼，其實個 infection 喺眼入嚟咧係好高嘅。同埋你掂到眼之後鼻你掂啲菌跌咗喺個面上嘅時候咧，你鬥下佢又戴捽眼咧，咁你就中招㗎啦。咁所以其實咧係好重要有個 eye shield， 所以其實搭飛機你嘅 eye shield 係好有幫助嘅。咁第三啦，洗手。其實咧喺醫院裏邊咧，其實我喺馬醫都教咗好多介紹護士咧洗手嘅。洗手咧係真能夠幫助你咧係降低你個感染，因為手咧係好邋遢嘅，你鬥咗每個鐵嘅東西，如果有菌咧。你捽咗眼咧中招 ，OK？ 所以變咗嚟講咧，喺尤其是COVID-19 咧，好多有 metal place 嘅地方，有鐵嘅地方咧，可能個菌就喺度一段時間嘅，唔會死嘅。咁佢亦都唔會飛去嘅。咁你鬥咗佢之後咧，點啊？全面啊，戴翻隻眼就捽捽，咁你中㗎啦。咁所以其實咧，好重要咧，就係要洗手 with hot water soap 同埋咧最緊要洗20個 second 啦，20秒啦。嗱，同埋仲有一樣好重要啦，繼續咧有一支咁嘅嘢成日帶住，咁你就可能夠咧去到邊度咧就洗手抹到邊度，呢個係一個十分好嘅東西。咁仲有啦，真係最後咧就唔可以成日捽下眼啊、捽下鼻啊、捽下口啊。如果眼痕咧，揾張紙巾最好啦，揾張紙巾。如果眼痕揾一張紙巾，咁咧就捽呢個眼咁樣就好過咧揾隻手去捽紙巾。咁其實咧，你都繼續咧係攞啲紙巾俾你自己啦，咁你就唔好鬥啦 ，OK？ 同埋咧，亦都唔好同每一個人咧係 contact 係要1.5米嘅距離啊，記住。So the next thing is do not touch your eye, nose, and mouth. I know it's hard because a lot of times you don't understand you ever touch it or not because you have a habit. Oh, I touch my face or rub your eye because it's itchy. So if it is itchy.Get a clean tissue, never use, and you rub your eye that way, rather than you actually use a finger touching your eye, because then you will actually very easy to catch a disease. And on top of that, you really gotta do 1.5 meter distance. So net result, at least you always have distance, and when you go out, always have mask, okay? Now, when you cough, sneeze, you always have a tissue with you, cough, sneeze.So you don't sneeze out because you know what? If you sneeze, you actually get your mist 6 feet away. People will catch it. Wow, imagine 6 feet away. That's how powerful we are. So you really have to continue to, if you sneeze, make sure you cover your mouth with this tissue and then you throw away the tissue afterwards. 嗱，記住 我哋咧唔好捽眼啦，唔好捽口啦，捽鼻咧有距離啦。但係最重要咧就係呢個咧，如果你咳或者係打乞嗤，你就一定要用呢張白紙乾淨嘅冚住嚟打乞嗤白紙，然後掉咗去。因為呢個咧，其實如果你咳嘅時候咧，你係出去嘅地方咧係有6尺咁多啊，咁遠嘅，咁 powerful 嘅，所以呢個要好小心。咁同埋仲有咧，你個每日嘅地方做嘢嘅地方咧，你一定每日咧揾啲alcohol 啦，我就每日就用呢一張紙擺啲alcohol喺度，然後我就抹咗個地方，咁就變咗嚟講，我每日嘅地方好乾淨，同埋我喺屋企裏邊咧。亦都喺個台邊做嘅地方，我都每日抹一抹嘅，因為我唔知幾時我 contaminate 都有咩嘢啊，都可以即係乾淨啲啦。咁同埋咧，你係要喺屋企咧，就如果你係病咧，你就 stay 喺屋企啦。咁同埋咧，如果你係覺得有任何嘅你自己嘅人或者你隔離鄰舍有呢個 COVID-19 嘅咧。咁你就真係要快脆同佢企離開，即係唔好同佢接企得咁埋啦。同埋咧就即係更加要盡量隔離啦。同埋依家咧喺呢個政府裏邊咧，如果你係有 COVID-19 咧，其實佢就要你去直情去一個隔離區嘅，喺隔離住嘅。咁就唔係話喺美國啦，其他地方就係你可以喺屋企啦嗰啲啊。咁但係其實要好真係同人哋隔離㗎 ，OK？ So now important every day you have to disinfecting your home with some disinfectant, which I talk about. You wipe your surface every day where you work, and if you're sick, you stay home. And the more important, if you realize somebody with COVID-19, stay away from them. And if you have COVID-19, you really got make sure you truly isolated. Don't go out and in Hong Kong certainly they will put you in a quarantine area. I think in the state a lot of time because they ran out of space, you got to quarantine home. Then you have to take a very good precaution. In other words, when you actually quarantine at home, you have to wear a mask all the time. Make sure you don't communicate with your own family, and that is so important. Now, if you're diabetic, unfortunately, a lot of places now have locked down. So net result of that, you really need to make sure you have all your supply, all the drugs with you. Now, in Hong Kong, we have a whole district, Central District locked down, boom, whole district because they have so many COVID-19 in this area, only about, I think, 20 or 30 or 40. But they locked you down, so you can't go out to get a medication, all that. So you really got to keep your diabetic medication prescription filled of all time. And I suggest you actually have 1 month stock with you all the time because a lot of time your quarantine is at least 14 days. So if you were suddenly being quarantined, you really have no way to get medication. So you should actually make sure you prepare all your medication, prevent your blood sugar, going up blood sugar, your glucometer or your Libre sensor, all your medication more than 14 days. So you can prevent, when you're locked down, you can't go out, at least you have medication, okay? 嗱，記住，因為咧我係糖友嚟嘅，咁我好多時咧我哋真係要一個東西咧，就唔可以咧俾到佢哋咧能夠冇藥啊！嗱，冇藥就好弊家伙啊！點解咧？因為咧冇藥嘅時候，如果你 lock down 咗冇藥，咁你點攞藥咧？咁又咪即係等佢你冇藥喎，咁你血糖高啦，咁你變咗好多問題出現㗎咯喎。咁相比嚟講咧，你會係尤其是你 hyperglycemic， 即係話低血糖、高血糖，你都要做一樣嘢，令到你係繼續控制血糖嘅。同埋最緊要咧，唔好話喂，其實有個糖友話俾你，喂即係佢哋病咗啦，我買唔到嗰個glucometer 嗰個 strip 啊，咁我唔知血糖幾多㗎依家，咁我有弊家伙啦。咁變咗嚟講咧，佢真係有個問題啦，因為佢唔知佢血糖幾多，咁佢又度唔到喎，佢又冇將來買喎，咁因為佢而家 lock down 咗啊嘛，咁變咗嚟講咧，佢一直要有晒嗰啲 glucometer， 即係個血糖嘅儀器咧，睇到佢嗰，或者用個 Diabetic 咧 睇到樣嘢嗱，我依家用個 Ability 有好啦，佢係14日，咁我依家5.6啊。如果唔係咧，你就弊家伙啦。咁因為你冇呢樣嘢，其實買多個 Ability 喺屋企都 OK 喎，因為佢唔會 expire 嘅。咁你能夠我如果真係 lock down 咗，你都睇到我係繼續 monitor 我 blood sugar， 唔會話忽然間我冇咗呢樣嘢，我度唔到嘅。咁我既然我有呢個嘢，我就喺24小時我繼續度啦。咁我度一度咁就 OK 啦。嗱，我有5.6，咁我話 OK 喎，冇問題啊。咁同埋咧，你嗰啲藥咧一定有最低限度咧 more than 1個月，因為咧你 lock down 會14日嘅。咁同埋咧，仲有咧，你所有個 treatment supply 咧 make sure 係有好多乾淨嘅東西喺屋企啦，洗手液啊，同埋咧仲緊要咧，好重要咧，去任何地方唔好用人哋個筆啊，因為好多時咧，如果我有病，由醫生嗰個診所咧叫佢簽字咧，用咗佢支筆，佢支筆可能前期嗰個嘢係有病嘅，咁用咗佢支筆咪染咗自己咯。所以其實咧去街簽任何嘢咧，依家最好用嘅筆。Important thing is really you have to keep your diabetic treatment, all the supply are very clean, equipment are clean and continue always disinfected. One of the things that very important, besides only washing your hand, make sure that before you do insulin injection, you wash your hand, keep good hygiene. More important, when you go to the doctor, make sure you carry your own pen because a lot of contamination is really from your pen. Because the person in front of you could be a COVID-19 infected. She didn't know, but you use his pen, his hand is contaminated, you sign the pen, and now you took his pen and you got the virus on your hand, and you touch your eye, you got the virus. Okay, so do not share the pen. If I sign, you know what? I will use only my pen to sign, and that result, I do not at least prevent that contamination. That is a very important tip. Now, also you have to treat any cold flu medication. Make sure they are low blood sugar type of medication. In other words, you are not able to take cough syrup with a lot of high sugar. Okay, so 嗱，所有嘅感冒藥咧，好多時啲人都冇睇嘅，因為感冒藥好多時咧就以為哇 OK 喎，感冒藥去啦咁，但係其實咧好多感冒藥咧係咩啊？有好多糖喺度嘅，所以其實咧你要知道咧嗰啲感冒藥係唔係會影響你個血糖高咧？第一 cough medication 即係個咳藥水啊，好多咳藥水裏邊係有好多高糖，因為啲人用入口啦，係咪 ？So 你一定要知道咧，呢個咳藥水係咪好多高糖嘅，同埋咧亦都有好多藥咧，亦都有糖嘅。咁你應該睇嘅咧係咪個 low blood sugar 嘅即係低糖嘅 cough syrup 啊，同埋咧就亦都係其他藥片啊，都係低糖嘅或者冇卡嗰種啦嚇，即係冇碳水化合物嘅藥啦。So very important when you take medication, you really gotta think about. Make sure you take low sugar syrup or basically a lot of them is actually no sugar cough syrup. Then you can able to actually make sure you take the cough syrup doesn't increase your blood sugar. And also you got to do something as in pills. Sometimes the pill also have sugar, so you have to have low carbohydrate pills or syrup. Make sure you don't get that. You take because you take about 4 or 5 cups a day, and that result increase your sugar. That's not going to help you. Okay. 嗱，仲有啦，你一定咧，因為你 cold flu 咧有好多 symptom 咧，即係要希望你咧唔會有鼻塞啦。咁你食啲藥咧就要俾啲鼻塞嘅藥粉藥片啦，所以一定要 decongestion 嘅藥片咧，你係要有喺度啦。So when you have flu, you really have to have medication besides cough syrup. You have to also do something with decongestion, so your nose cannot be all stuffed up, so you're breathing and with difficulty. Now, we found that Advil actually, Advil is really not as a very good medication for diabetic because what happened is it is increase your hypoglycemic effect with your insulin. So if you have Advil, if you're diabetic, maybe not too good Advil, but you can take Tylenol, get a lot of Tylenol, or in Hong Kong, you take Panadol, okay? So you keep in mind, if you are in the United States, maybe not to take Advil because it increase your hypoglycemic effect insulin. But in Hong Kong, Panadol Tylenol is good. So 喺香港咧，你就應該攞多啲 Panadol 啦，同埋咧就喺美國 Advil 就唔 good 嘅，因為佢能夠影響你嘅 insulin 啊。所以其實最好就多啲 Panadol 拎上喺晒度。咁你如果你發燒咧，就快啲可以食 Panadol。Now the thing is this: if you are diabetic, if you are sick, what happened is since you're sick, you know your sugar will go up. Because your body will say, hey, I'm ready to war because, I'm sick. So your insulin is also going to pump up. But the problem is because your rise of blood sugar, you're going to have more insulin resistance. And then if that's the case, even though you didn't eat much, but how come my sugar keep going up? Because the body will prepare you for war, so they pump up more insulin, even you didn't eat. So you really have to monitor your blood sugar to ensure it didn't go up without you knowing, and that can be bad for you if that's the case. You keep that in mind, okay? 嗱，記住咧，當你係有糖尿病病者嘅時候咧，當你病咧。你個血糖咧會繼續高嘅，點解咧？因為個身體話俾你個身體聽，喂，你個身體準備打仗喎，咁你要多啲血糖咧，唔使會係即係多啲血糖幫助你去打仗。咁你話冇食嘅，點解個血糖繼續高咧？因為你病，個身體自己會泵啲血糖出嚟咧，係幫助你去有多啲動力去打仗。咁嘅情況下咧，你個 insulin 可能唔夠喎，因為咧你 insulin 咧係會繼續咧。係泵咗出嚟，但係你繼續有好多 insulin resistance， 咁啊帶唔到啲糖入去管道，咁所以其實咧，就算你冇食嘢咧，你都會血糖高嘅。記住喺病嘅時間嚇，咁同埋咧，你即係去 measure 下你血糖係點樣啦？朝頭早啦，食完晏晝啦，晚黑啦係點樣啦？或者你如果有 ability 咧，真係要 measure 多啲啦，因為如果你唔 measure 多啲咧，你有個情況下咧。喺你病嘅時候，血糖值到好高，依家5.5啦 ，OK 啦。如果唔係咧，你就會 end up 太高嘅時候咧，你嘅血咧就會係變咗 acidosis。咁呢個咧就 keto acidosis 係一個好危險嘅病出嚟嘅。So keep that in mind. You need to continue to measure your blood sugar. That's why if you really have flu, actually it's a good idea to drink low sugar tea because low sugar tea is your lower blood sugar booster. They help you bring the sugar into the bloodstream. So net result of that, you are actually helping you to actually lower your blood sugar even though you didn't eat. So think about low sugar tea. And on top of that, it helps you to increase your fluid intake because you were supposed to drink at least 2 liters of low sugar tea, actually 34 ounce or 64 ounce. You have 2 times. 34 ounces, 68 ounces of fluid. So increase the fluid, it hydrate you, it help you to decrease your blood sugar, and also it give you more fluid. It will help you to improve your symptom of your flu. Okay, so and also because of the fact that your blood sugar continue goes up even you didn't eat, and because the body is giving sugar to fight. So the chances for you to get ketoacidosis are extremely high. And that is a really life-threatening disease because your body just don't have enough insulin to convert your sugar into the bloodstream. So your sugar are continue to go up and your liver will say, hey, I don't have enough sugar into the cells because the insulin doesn't take the sugar into the bloodstream, or either high insulin resistant, so the sugar in the blood does not go into the cells. So the body will keep pumping up sugar from cells, from your muscles, into or fats into the bloodstream. Net result, when you have break down a lot of fat to sugar, you know what's going to happen? Your blood become very acidic in the bloodstream. and net result of that, you coming out to a condition called ketoacidosis. And I saw a lot of these patients in ICU, and they're dangerous. They can die. Okay, so you gotta watch this one. 嗱，各位堂友，一個好重要咧，好多人都唔知嘅，你要記住，當你血糖係唔係咁穩定嘅時候咧，咁你係病喎，咁我係冇食嘢，咁血糖應該唔高㗎。但係個問題咧，你血糖咧喺個血管度一路增加，但係你又唔夠或者胰島素，或者胰島素係好 resistant， 啲胰島素係帶唔到你糖入去個細胞裏邊，咁個身體就話：哇，我唔夠糖用喎。咁你咧就會身體咧繼續去揾啲糖，咁你個地方揾糖嘅地方咧就喺嗰啲 fat 喺嗰啲肥細胞嗰度 muscle 嗰度，亦都 liver 嗰度咧係放啲糖出嚟幫助你去打仗，但係啲糖入唔到個 cell 數喎，咁你營都係冇喎。越整越你嗰啲 fat 你個脂肪係放啲糖出嚟嘅時候咧，你個血咧就越整有個 ketone 喺裏邊。就你個血裏邊咧，就越整咧係 acidic， 係比較酸性高。呢個做咗呢樣嘢之後咧，你就仲有一個病徵出嚟咧，叫做 ketoacidosis。嗱，呢個係一個十分嚴重嘅病嚟嘅。如果你係真係有個 ketoacidosis咧，你係要好快脆咧要入醫院嘅。嗱，呢樣嘢咧，你記住係點會知道呢樣嘢咧？我會繼續解釋。但係如果你係真係喺即係好多病人咧，尤其是依家喺英國嗰啲病人咧，喺COVID-19 咧，好多咧喺屋企係冇中招㗎，佢只係咧喺屋企，但係佢糖繼續高，咁但係咧 end up 咧就係變咗係 ketoacidosis， 咁咧就要入醫院嘅。喺英國好多呢個病人，咁亦都好多係因為咁樣入到醫院咧，有好嚴重嘅病出現啦。So really, a lot of people, especially UK, who has, not in the sense they are necessary to be a COVID-19 patient, but if they are, many of them actually they stay home to be isolated, not in the hospital, and they end up because of the fact that they're isolated and the blood sugar are continue to go up, and they realize that wow, I didn't eat, why my blood sugar goes up. So they don't really not monitor that. End up many of these patients become ketoacidosis, and they actually end up really got in the hospital very emergency got in the hospital. So very important. Many of the high number of COVID-19 patients in UK actually became ketoacidosis. So very serious issue. 所以英國好多係 COVID-19 嘅病人，或者就算佢唔係啦，有啲係，但係佢因為佢英國唔俾你去冇咁多醫院俾你入去嘅，咁佢屋企係即係隔離啦，咁 end up 咧佢就變咗即係 ketoacidosis， 咁好多就 end up 入醫院嘅時候已經係 ketoacidosis， 咁要好注意。仲有啦，咁你話我點知我係 ketoacidosis 啊？我點知係 DKA 啊？嗱，簡讀嘅 DKA 啦 ，OK。最常見嘅 DKA 嘅 symptom 咧就係咩咧？有個 fruity smell 個口腔裏邊咧好似有果味咁嘅，呢個係常見嘅。同埋咧仲有咧好多時係好攰係好似成個即係散咗咁樣。同埋咧仲有要好中意想飲好多水，同埋要去好多屙尿。有啲就有呢個。肚痛啊，同埋咧要作悶啊、作嘔啊，咁同埋咧有一個好大問題，好多人咧就係唞唔到氣 ，shortness of breath， 同埋好 confused。嗱，呢幾樣嘢咧係嚴重病嚟嘅，你一定要快入醫院。嗱，記住呢個係唔係一個 take it lightly 啊？要係嚴重嘅東西。如果你係唞氣又真係有困難啦 ，fruity smell 啦，即係個果味嘅口腔啦，好攰啦。成日唞氣唔係好掂啦，同埋成日去廁所咁呢啲咧就一定要快要教十字車入醫院啦。咁如果你唔做唔到嘢，一日後咧你個身體可能真係 end up 做死人嘅。OK， so if you have symptom of like weakness or fatigue, one of the prominent symptom is fruity smell. initially there's no sign and symptom, you know, DKA. But once you start getting changes, you got to start getting a fruity smell. Plus, you got to start getting shortness of breath, and you're going to feel very confused. You have thirst. You sometimes have nausea and vomiting, and you have stomach pain. Now, when you have that, you better call an ambulance and get into the hospital, because this is a really serious problem. Now, usually people, another problem, if you can able to stick a finger to look at it, your blood sugar usually are 300 milligrams per dil or 16.7 ml per dil for liter. That usually are the high point of the blood sugar. And that result of that, you also see that if you're high, you better bring it down. If you don't bring it down, you're going to have problem. So really at the end of the day, you got to check more frequent of keto doses. You got to check your blood sugar. Plus certainly, you got a high ketone level of your urine. Sometimes you don't have ketone urine state, but the blood sugar definitely will tell you. 仲有一樣嘢一定睇到咧，你係會有呢個 ketone acidosis 即係 DKA 咧，就 check 你嘅咩啊血糖。你嘅血糖如果多過16.7嘅時候咧，你呢個係一個好高嘅機會有DKA 嘅。咁所以咧 check 個血糖係好緊要，同埋繼續 check 多次，因為好初期嘅 DKA 咧係唔會有什麼現象嘅。但係當你一去到一個位置嘅時候，即係話你去到300以上嘅milligram per dil 或者16.7 18咧，你個 DKA 咧就好快會出現㗎啦。咁就頭先所講嘅東西咧 ，shortness of breath fruity smell 係常見嘅。咁呢個一定要注重。咁啊，仲有啦，其實我哋依家如果係 COVID-19 有好重要咧，即係 keep 住你個 lifestyle 咧。係要 diet exercise 要 keep 一個係 healthy lifestyle， 同埋咧 make sure 你瞓得好啦，同你 relax。因為咧，你如果冇呢樣嘢咧，會係一個好大嘅問題。因為你緊張咧，你血糖高嘅，緊張血糖高嘅，要 relax 嘅。咁同埋咧，同啲朋友多啲傾下偈啦，你同你親戚或者你個同伴都要傾下偈咧，係一定要知道呢樣嘢嘅。即係要大家去 support 大家啦。當你 support 咧，我哋會係能夠令到即係你嘅心情咧會降低好啲啦。咁你唔會好緊張啦。咁你個血糖咧就會自己降低嘅。So very important, you really got to keep your healthy lifestyle with dieting, exercise, watch your weight, and also sleep well. Now, and also need to relax. Very important, getting some friends to talk to, relatives or peers, whatever. 你要俾啲你嘅親戚同你傾下偈，因為咧好多時咧，我哋翻得好多堂友咧，亦都前期患病者同樣嘅問題啊。佢哋覺得哇好驚喎，會中招㗎。咁原來咧佢哋嗰啲心情咧令到係好大問題。So it's very important getting your friends support to help you to lower your stress, lower your worry. So more you talk about it, is better you are. So how can you actually get you better on diet? Continue low carb diet. So I'm going to tell you about low carb diet. Lots of recipe. We'll talk about bread. Today we're going to talk about 2 gram carbs, mash. So try to eat those. A lot of salad. Remember, we talk about low carb is 1/2 are all low carb. Vegetable, a lot of fibers, and then 1/4 is your low carb like meat, lean chicken, and then 1/4 is really the higher carb product. So net result, you plan your plate will definitely help you to get low carb. 嗱，記住繼續食啲咩低碳酸pat嘅食物。嗱，我記得我哋個碟裏邊咧，第一半係全部啲 fiber， 即係有纖維嘅食物，生菜沙律嗰啲。1/4就係你嘅肉雞蛋嗰啲 protein 同埋但係都係低 carb 嘅喎，係咪？然後咧你加咗高啲 carb 嘅地方咧，咁你就係1/4。咁你變咗一個 plate planning 次食咧都係 balance 食都好嘅。咁仲有啦，你要記住咧，你要唔好驚磅喎，因為咧好多喺 COVID-19 嘅時間咧。啲人係增加磅數因為佢唔喐嘛，佢喺屋企嘛，咁變咗嚟講咧，佢就成日都唔增加磅數嘅時候咧， 咁就弊家伙啦。嗱，記住，如果你 BMI over 40咧，你係有個大嘅機會啊！如果中招咧，係會有死亡嘅，因為依家 BMI 40嗰啲人咧係嗰啲個 death rate 係高好多嘅，同埋對心臟都唔好啦，亦都對血管又唔好啦，亦都對糖尿影都唔好啦。So remember, you gotta watch your weight because a lot of people who are COVID-19 patient, not patient, but during COVID-19 time, a lot of people, the weight has continued to go up. Net result, many of them really have a lot of issue with their weight. And if their BMI are over 40, the death rate is actually high. And then also you need to really go with good exercise, walk in a park, shopping mall. I actually walk shopping mall every other night now, but I do it as 8 o'clock, 9 o'clock. Nobody wants to shopping mall. It's so big, air conditioned. They give you music, and I walk 10,000 steps there with my wife, and that's wonderful. Or if not, go to walk in the park is good too. But in Hong Kong, it's cold now, so I walk in the shopping mall. But in Hawaii, walk in the park, or go to other places, still walk in the park, or warmer places. If not, if you are cold places, walk in a shopping mall with very little people, so you're not able to always have distance away from people. 嗱，記住 exercise 真係好簡單，行1萬步咧就搞掂嘅。我晚晚咧唔係晚晚啦 ，every other night 啦，即係隔晚啦，我就可以行一個 shopping mall 咧，就係大概1萬步啦。因為 shopping mall 有冷氣啦，又唔會凍啦，咁啊幫助你係舒服好多嘅。咁同埋咧，如果係嘅，可以行到花園更加好啦。但係香港凍咧，依家花園行唔到啦。咁但係其他地方暖嘅啦，可以行到花園就 very good。同埋好重要嘅真係咧，要揾你啲親戚朋友，大家傾下偈，同埋咧唔會令到你自己會係頹喪啦，或者係憂鬱症啦，或者係令到你 depress 啦。其實咧呢個咧係要繼續咧係 motivate 你係能夠點樣能夠管制你嘅血糖，同埋咧繼續係 measure 血糖。所以呢個咧係好重要嘅，因為如果你唔同人傾偈咧，越整你越驚，越整你又唔想出街，咁就係家伙啦。So very important, you gotta get to your friends to support you, especially your relative, your peers, prevent you from going to depression, get you to be more motivated to manage your blood sugar. And I have a lot of actually diabetic friends call me all the time, asking me issue here and there because they're depressed. And I can understand where they're at because they really worry. And there are a lot of things you do not understand. When you don't understand things, you know what? You get worried. And so get answer. I'll talk to friends again. Once you find out, okay, I have a solution, you will less worry. And that decrease your blood sugar. 所以其實同親戚朋友傾偈咧，俾啲 solution 咧係對你十分幫助，有重大嘅幫助嘅。咁啦，最後咧就如果你係病咧，就真係要去見醫生。尤其是你覺得你係有 COVID-19 嘅病咧，你一定要記住咧，如果你病，你要話俾醫生，我係糖尿患病者嚟嘅。咁呢個咧係一個好重要嘅話俾醫生聽呢樣嘢。So when you are sick, you need to keep yourself the COVID-19. Are you COVID-19? Or you have to definitely tell your doctor or the medical healthcare people you are diabetic. You have to have that in there so they know they will treat you a little bit differently because you are getting potentially sick, more sick. Okay, so when you really go to see the doctor, you really prepare some of the things that written down. Like for example, when your sickness started, a lot of patients don't remember because they get so sick. They don't know, as I started 4 days ago, 2 days ago, they don't know, they forgot. So it's good to write down when I start getting sick. So when I got a cough or whatever is 4 days ago. And what is the sign and symptom? For example, I have runny nose, I have a sputum, I have this and that. You write it down. So when you see the doctor, I say, hey, 4 days ago I have this, and 5 days ago I have this, and I've started getting run. Whatever, you gotta tell the doctor. And it's best if you can tell the blood sugar value what you have. Like when you talk to the doctor, hey, I put my finger, it's actually 10 or 11. If you have a blood, if you have epilepsy, even better. I can give them the whole chart to tell them that, look, I'm 5.6, but now it's not 5.6 because I'm 6, usually 10 and above. So you show them the whole chart what you do. And you ask them, did I miss any medication or what medication you're taking?
And importantly, do you have any respiratory discomfort, like have shortness of breath? So they usually do a O2 saturation. Maybe you are 90 or 85. You're 85, you have a problem because you have to have O2 because that means your blood doesn't get enough oxygen. Do you have any nausea and vomiting? Did I eat anything or haven't eaten a lot? If I drink a lot water, and do you have a sign and symptom of TKA? DKA, if you have, you gotta tell them I have fruity smell and all that. But anyway, that is the things that you have to talk to doctor. 嗱，當你見醫生嘅時間咧，好重要咧，你真係話俾醫生聽，我幾時病㗎？因為原來有好多我同好多家庭醫生講咗咧，原來好多病人尤其是老一啲嗰啲咧，唔記得幾時病喎，係咪一個禮拜前啊，或者3日前啊？我幾時咳㗎？我幾時喉嚨痛啊？唔記得喎。咁個醫生就會估咧，唔知係真定點啊？有咩問題咧？咁變咗個 treat 你嘅醫生嘅時候好多問題，所以記住寫低我幾時開始咳，幾時開幾時開始鼻塞，幾時係喉嚨痛，寫低晒佢，同埋我會食咩藥寫低佢，或者我唔記得食咩藥，亦都寫低佢。我會有不同嘅呼吸症狀，唔係好舒服咧，寫低佢。同埋咧，我咪肚屙肚瀉，亦都會寫低佢。同埋我有飲咗幾多嘢，食咗幾多嘢，要寫低佢。嗱，呢啲係十分重要，係幫助醫生咧去診斷你個病理啊，所以呢個係十分重要嘅。咁同埋仲有冇其他嘅症狀係 DKA 咧？咁呢個係好重要，有冇 fruity smell 咧？有冇 shortness of breath 咧？呢啲係要話俾醫生，咁醫生就即刻要出嚟嘅。嗱，咁呢個咧其實咧呢7樣嘢咧，我就再總結一下啦。第一 ，you have to follow. I'm summarizing it. Basically today the webinar is really to figure how to you prevent your and help you support you for better manage if you're diabetic or pre-diabetic, because pre-diabetic have the same issue. So you need to learn about this too. Now everybody need to follow the World Health Organization WHO guideline. The most important wear masks, and you have to keep washing your hand clean, frequent wash, and social distance. Now, if you are in a crowded place, wear face shield to help you prevent, airdrop to your eye. Do not touch your eye. Use a tissue, okay? So 嗱，記住細米咧就話一定要有個咩啊面罩，即係呢個 mask 啦，變咗嚟講你唔會感染人又感染到你啦，成日洗手啦，同埋咧仲要咧要距離1.5米嘅 distance 啦。如果要咳啊、抹眼啦，用嘅手巾紙啦，記住晒呢啲樣嘢。So if you're diabetic, you make sure you have number 2. If you're diabetic, you make sure you have all your medication are filled at least 1 month stop, because occasionally suddenly you got locked down or you have to go somewhere. You have that medication there. You cannot go out and buy anymore, or you cannot go to somewhere to get the medication. You are in trouble. You have to get your medication to prevent you to hyperglycemic, high blood sugar, or low blood sugar. Both of them has to have it. Low blood sugar, you have to have a sugar pill with you, so you don't get into a shock because you're low blood sugar. 嗱，記住，因為你糖友咧，你所有藥咧都會有1個月嘅藥喺你手度咧，能夠令到你咧係隨時如果 lock down 咗，我即刻有藥嘅 ，OK？ 咁啊，仲有啦 ，so if you have diabetes, you also have to keep all your supply equipment clean, disinfected, to make sure that you every day clean that. Make sure you don't contaminate with pen when you go to a doctor office, because that is one of the biggest contamination. Because the guy in front of you has COVID-19, you touch it, the chance of COVID-19 is high. Okay, so make sure bring your own pen. So keep a diabetic treatment area, everything is clean, especially when you take insulin, washing hands, and so forth. 嗱，記住糖友咧要記住你所有用嘅東西要乾淨嘅，因為你個感染性係高嘅。尤其是去醫生嗰個地方咧，佢支筆唔好用嗰前面嗰用個支筆。如果有 COVID-19，most 人都有 COVID-19 啊，所以用翻你自己筆 ，OK？ Number 4. So what the treatment of flu medication, where you make sure that the flu medication doesn't increase your blood sugar, like syrup, gotta be no sugar syrup, and make sure that you do not take few times cough syrup is a lot of the sugar. Plus, you have to have all the flu medication like Tylenol, Panadol. Those are items that you have to have it to lower blood sugar. This congestion has to have because you might be so sick you cannot go out, or you locked down you cannot go out. So those flu medication you have to have it. 記住，我哋如果係有好多叫做感冒嘅症狀咧，你記住有晒嗰啲 Panadol 啊，喺屋企啊，咳藥水啊，decongestion 藥水喺晒度，因為好多時你出唔到街。咁你變咗嚟講真係好辛苦啦。咁既然有晒嘢喺度，第五項watch unstable blood sugar, so you don't able to get into ketone acidosis. Very important because when you are isolated, your blood sugar can go up even though you didn't eat. The blood sugar will go up, so you have to prevent yourself getting ketone acidosis. And so you got to watch that unstable blood sugar. Check your blood sugar. Poke yourself blood sugar. So watch the sign of ketone acidosis, like fruity smell and so forth. 嗱，因為咧你血糖咧，就算你冇食嘢咧，都會高。嗱，繼續高嘅時候，你唔夠 insulin 咧，就會變咗 N 咧，就有 ketone acidosis， 呢個 KDA。咁但係呢個好重要嘅，點解咧？因為呢個係重要病嚟嘅。如果有呢樣嘢，你會死人嘅。所以咧，你一定要記住 check 你個 blood sugar。如果你過咗16或17咧，你快出去揾個糖要降翻低。如果唔係咧，飲有可能咧，最好你飲啲去糖茶咧，亦都會希望降低。但係呢個係要入醫院嘅事嚟嘅。所以咧，飲多去糖茶就唔會令到你血糖咧去到16、17啦。咁呢個係一個有幫助嘅，所以你記住做呢樣嘢。If you haven't eaten a lot, make sure you drink a lot of low sugar tea, help you to lower your blood sugar, increase your fluid, maybe 2 liters a day. So hydrate your symptom can be better. Okay. Number 6, you have to keep up your lifestyle with good dieting, exercising, watch your weight. You have sleep well, relax, and getting friends and relatives support you. Don't get overstressed out. Okay, this is important because stress go up, but your blood should go up. So 你哋一定要喺個 lockdown 或者喺個 COVID-19 唔出咁多街，都係要繼續咧有個好嘅生活你有 lifestyle 啦，個 diet 要控制啦，要做 exercise 啦，要 watch 你個重磅啦，唔好高過咗，記得 sleep well 啦，因為你唔 sleep well 你就點啊？你血糖會高 up 嘅，你唔 relax 血糖高啊，揾你朋友傾下偈啦，同埋要令到你唔好咁 stress out 啦，因為好多人咧。繼續喺度嗌死唔同傾偈咧，就會 depress stress 咁呢啲全部對你身體唔好嘅。咁一定要記住，多啲朋友 support 係對你十分好。仲有 call your doctor if you are sick. Number 7, call your doctor if you are sick. If you think that you might have COVID-19, or you make sure to tell them that you have diabetes. Now, whether you have COVID-19 or not, it really has to be maybe checked by going to a hospital to check. But important or doctor office to get a check with your or go to a check center. So you really, when you talk to people, doctors, when you think that you have a flu symptom, make sure that you're also diabetic, because then doctor can also tell you, wow, okay, make sure that you treat it first. The reason is because you can change yourself very fast to ketoacidosis. And they will check the sugar and give you more checking to ensure you are not entering those high risks. Okay? 如果你病好似有 flu， 唔知係咪 flu， 好似 COVID-19 亦都唔知，咁你醫生嗰度咧你就話俾你聽，我係糖尿病病者嚟，因為糖尿病病者你真係可能個病係轉得好快嘅，咁所以變咗嚟講咧，如果你唔知你係 COVID-19 啦，因為你亦都唔知要 test 先知噶嘛。咁好重要咧，就真係話俾醫生聽，我係糖尿病者，因為你糖尿病者咧，佢能夠 check 你嘅 blood sugar 嗰啲樣嘢咧，都能夠令到咧係更加係快咗，係幫助你咧係令到你係會快啲check 到你嘅傳意咁啦，係咪？嗱，咁我依家咧講晒咁多嘢啦，咁我就開始咧播今日嘅節目咧係好特別咧，就係講及呢個咧係做呢個 cauliflower， 咁你繼續聽咗啦。
Hi, I'm Angela Losuti present. How are you? Wow, today is so cold. So we're gonna do something special for you. Hi, I'm Angela Losuti present. 你好，哇，今日好凍啊，因為出邊咧係只有得7度，咁所以7度咧，好多人就話哇，不如我哋食多碗飯，咁啊保下暖啦。但係其實食一碗飯唔係咁好啊，點解咧？食一碗飯咧就增加咗你80克嘅碳酸啦，係咪啊？所以今日我哋俾啲特別好嘢你，應間做下咧係咩好嘢？嗱 ，if you are cold like today is 7 degrees outside and actually is 44 degrees Fahrenheit. Well, today is very cold. That's why you see the scarf, getting warm clothing. Now, with that, a lot of friends asking me, hey, you know, I'm so cold today. I'm going to eat one more bowl of rice. But you know, and one bowl of rice, you know, you got to add on 79 grams of carb. Wow, almost 80 grams. Wow, that's terrible. So I will give you something very special and very good and delicious. And that is what? Cauliflower mash. 嗱，今日又特別俾個好嘢俾你食咧，就係咩啊？椰菜花 mash 咗佢，即係用一個椰菜花煮熟咗之後，然後咧就用好似 mash potato 一樣，咁然後咧就可以又熱又好食。OK， 好容易做。嗱，首先第一，你就將呢個椰菜花一球嘅椰菜花咁大個度啦，咁然後咧就用 steamer steam 咗佢大概16分鐘。So the very simple thing is using the one head of cauliflower and you steam it for a total of 16 minutes. 16 minutes. And after the steam, it looks something just like this. Okay? And then you are ready to go. Now, the rest of the ingredients even more simple. One, you have 2 tablespoons of cream cheese, and then you have 1 tablespoon of butter, and then you have salt and black pepper and garlic powder, and then certainly we have the cauliflower, and certainly we have also 1 tablespoon of parsley, which we do it at the end. Okay? So 嗱，原料係十分容易嘅。第一，我哋係有2個大匙羹嘅 cream cheese。第二，有胡椒、黑胡椒，亦都有呢個鹽啦，同埋garlic powder 啦，然後再加多係1個大匙羹嘅butter。嗱，你唔中意 butter 都可以嘅，我用 olive oil butter。咁然後咧，我哋就擺落去咧，就撈佢，然後咧就用呢個 mixer 機咧係 mix 到佢好勻勻就得啦。So it's very simple. I will do this by just adding the cauliflower into here, just like this. Drop it in, and then now it's in here, and I will basically just bring down all the cream cheese. Okay, drop it in the cream cheese, and then we'll get the butter. You see the butter coming here. Now you don't use butter, you can use olive oil. It's the same thing. And olive oil is okay too. You don't like butter, but I thought butter is a little more, you know, nicer. And then you put the garlic powder, salt, and pepper. So garlic powder, salt, and pepper. Matter of fact, if you like this, you can eat it every day. And a lot of people actually do it, and it's only 3 to 4 grams carb, depends on what you put in there. Okay, so let's do this now. I will just bring this now. 其實呢個咧日日食都得啦，你唔食飯食呢個咧係好正。咁大概係3至4 gram carb 嘅啫。你睇啦，我依家開始嚟啦。我做咗啲咧，已經睇到好似mashed potato 一樣啦。You can see that, you know, look like mashed potato. You can see that? How easy? Now you do this only about 2 minutes, okay? Is that almost easy? That's how easy it is. Okay, pretty much done. Okay, it's pretty much done. Now, let's see. I will do a couple more times. Okay, right here. Okay, done. Okay, it's pretty much done. Let's see. Okay, here you go. Here, and then I will try to do this. Yeah, pretty much nicely done. And what I will do is I will now put some of the parsley into here. You can see. And mix it up. Okay, now you can see, look just like mashed potato. And this is gonna put right here, and I'm gonna put my cauliflower mash into this container. You see how nice? Okay, wonderful. Okay, good. Well, let's see how delicious it is. And try this again. Now, 呢個就係 cauliflower mash 啊，你睇幾靚仔，你睇下到，哇，好靚仔喎，睇到嘛 ？Okay, so we just go this and see how good it is. It's really delicious. Especially in a cold day. This is delicious. It's excellent. I'll get myself just a little bit more. Remember the other day I had the chicken parmesan. This will be excellent. Go with it because I did it several times already. It's so wonderful. It takes you less than 10 minutes to prepare. So it's wonderful. Okay. So again, this is cauliflower mash, and you enjoy this daily in a cold night. This is Angela. Enjoy my cauliflower mash. It's wonderful. It's just delicious. Bye bye.
Okay, I hope you enjoy the cauliflower mash because that will help you to kind of understand what is making a 2 gram carb mash, and is very, very delicious. And so remember, it's important to always continue to put dieting, exercise, lower your weight. Then you really can decrease your blood sugar and diabetic weight. And more important, you have to drink a lot of low-sugar tea to help you to lower your blood sugar. Now, I'm going to answer some questions. 嗱，記住要食得好，要做 exercise， 降低你嘅重磅，咁咧你就能夠降低血糖。咁其實最緊要飲虛糖茶啦，因為虛糖茶咧真係會降低血糖嘅。咁你就可以做晒呢啲嘢咧，就其實有一個好大嘅幫助。咁就變咗咧，令到你咧係能夠可以有一個即係好啲嘅血糖啦，咁所以變咗咧就會幫助你係能夠更加係生活喺呢個糖尿患病者唔係糖尿患者都可能夠好嘅繼續生活同埋繼續 enjoy life，OK， 繼續係享受你嘅人生 ，OK， 因為如果你降低到血糖，你人生一定係會好開心嘅。OK， 嗱，咁我依家咧開始咧就答問題啦，因為今日好多問題啊，其實好多人都有不同嘅問題出現啦。咁第一個問題咧就係 from N Mac，OK， 佢問咧係咪普通嘅用針刺嘅血糖紙咧測血咧，比其他有冇其他嘅方式測驗咧係驗血係更加好咧 ？OK。 So the question is, if I check my blood sugar, am I only use, the stick, finger picking is really the best. Now, to be honest, because I have this, which is Abbott Libby, and a lot of my customers really found that this is something very, very good and easy to work with. 嗱，其實我哋好多糖友咧用咗我哋嗰個叫雅培嘅測驗機啦，咁你又唔使篤手指24小時繼續係測血糖，亦都係知道你個 A1C 幾多。咁咧我得喺度咧就撳到落去咧，咁我就知道我血糖幾多嘅。我有粒的喺度啊，其實呢度係嘛？咁我就咁我就知道我血糖咧5.7好簡單。所以其實咧，呢個係一個好個方法咧，係令你嗰個血糖咧係更加容易處理，同埋更加係monitor 啦，係會做14日係做呢樣。咁我好多糖友咧，好多糖友用緊呢樣嘢，佢哋好開心，同埋咧仲係降低咗你食嘅嘢咧。你知道如果食 buffet，我即刻食咗2個donut，我血糖高急。咁呢個咧係幫助你即刻了解你係咪血糖。嗱，今日成日個血糖都 under 7底下嘅，你可以睇到個有 graph 俾你，每日都有嘅 ，OK？ 咁24小時 monitor， 唔會篤手指，亦都唔痛，所以 extremely good. So my answer is, you pick a finger, oh I really sore, baby, I don't feel like good picking a finger. Hey, get Abbott Libby to do it. Ask the doctor to get it to you, or you can buy from us or whatever. But you can get one to help you to measure blood sugar 24 hours for 14 days, no pain, no hassle. And also you can even get an idea of what is your A1C look like. So you can actually, if you measure about 3 months, you can actually get a tremendous blood sugar profile for your doctor. It could help you to lower your blood sugar if you drink low sugar tea. Because a lot of my clients now drink low sugar tea using Abbott Libby, they actually see it work. Doctor lower the blood sugar. So 好多我哋糖友咧，因為飲咗去糖茶啦。咁佢見到成個 sugar profile 降低咧，醫生連呢個糖嘅藥咧，即係糖尿病藥減低咗佢，又要打胰島素亦都唔使打。咁呢個係我哋現有好多人都有呢個同樣經驗，所以呢個係十分好嘅東西。OK， I hope I answer you. And if you have any question, I'll ask you answer again. Now, 阿裕堅亦都問咗好多 question 啦。第一咧。So I have a lot of questions from Eugene. Talk about pre-diabetic. Does this tip help if I'm already diabetic? Keep in mind, what I told you just now is actually not only good for diabetic, it's also good for pre-diabetic. 今日我所講嘅嘢唔係淨係快糖尿病啫，前面話俾你一樣，因為最重要咧係降低血糖。第二樣嘢，如果你嘅糖係高嘅話，你個所謂嘅即係 immunity 你個抵抗力係會低咗嘅，咁你嘅感染係高嘅，咁同埋防禦你個感染係一定要盡量大家，就算你唔係糖友或者前面話，你都有同樣嘅要做同樣嘅防禦工作 ，wear mask 戴眼罩洗手一樣嘅 ，so it's going to be very helpful on that. Okay, complication. Do you mean poor circulation? 嗱 ，complication 咧。其實如果你係糖友咧，有個 complication 咧，好多時咧你隻腳咧，如果你啲血唔係落去隻底下隻腳好嘅時候咧，你撞傷咗隻腳咧就唔好。咁我見過好多糖友咧，真係要割咗隻腳係好慘嘅。So 呢個係一個好痛苦嘅東西。咁你咧就要真係要小心呢樣嘢唔好俾佢即係啲糖好高啦，同埋你嘅腳咧，亦都冇得處理啦，同埋亦都俾佢著鞋又唔 cover 隻個腳撞到咧，咁你弊啊！咁好多人咧就 end up 即係發炎要割咗腳。So imagine you really have to make sure your blood sugar is not completely high and make poor circulation, and that result you hit yourself, it won't heal, and you actually end up with cutting a foot. That would be very, very dangerous. Okay, so if you have another question, if you have minor symptom, what should I do in 10 to 14 days? Now, the real important, you got to ask yourself what kind of symptom you have. 如果你有咩症狀咧，你係 quarantine 啦，係10至14日啦，你有咳啦、發燒啊，如果你真係發燒有氣喘啊呢東西咧，咁你就真係要話俾醫生聽話，我而家 quarantine 有14日，但係氣喘喎，咁呢個就要快啲醫治嘅，因為我唔知你氣喘係咩情況啦，呢個可能你就係 quarantine，如果你嚴重咗之後咧，你就要送翻你入去，即係一個醫院裏面喺做 ICU 嘅地方。So if you have symptom, just minor, you depends on what kind of minor you talk about. As the most important is your face turning blue, you have a hard time breathing. You really have to ask what kind of symptom. But you have just typically, runny nose. That is minor symptom. You can able to watch a little more. But the important, if you have a hard time breathing, so you really have to be very, very think about, are you really in a stage of ketoacidosis or blood sugar is high? You take another data was 16, 18, 300 and more. You got to be watched. So those are things that you have to ask for help. So important is you have to examine, asking, really, are you really need to additional hospital help? So other symptom, example, discoloration, I should watch out for. Now, discoloration, your foot, if you hurt your foot's not healing well, it's starting turning blue, getting swell, got an infection. Those are one of the discoloration that you will need to talk about if you have a foot circulation. Because diabetes, a lot of time, most important is their foot has to be not to be injured, has to be well waxed with oil, moisture, not cracks. Those has to take care. Now, discoloration of face, if you are diabetes, that is some other different questions, because when your discoloration of blue, turning blue, that means your oxygen not enough in the cell. That's why you're turning blue. And your lip is turning blue. So net result of that you need to go to hospital, because you really cannot do much to yourself, because your oxygen are not getting into the cell. So you need to go to the hospital, get treated, like getting oxygen and all that. So there are a couple of things you have to look. Make sure you're not shortness of breath. Make sure you're not getting discoloration of the lip and face, getting blue, okay, or getting gray, okay. That's another usually some of the sign that you will come up. 如果你個面係變咗灰灰地，開始 lips 個嘴唇藍藍地，你好難唞氣，咁呢個咧就真係有症狀咧，係或者有幾樣嘢。第一，你係咪 ketoacidosis 啦，或者血糖好高 ，OK， 或者你真係已經係中咗招，你中咗招之後咧，你個 COVID-19 好開重啦，咁你 affect 到你肺個 gas exchange 唔高，咁你個 O2 saturation 咧就會降低，哇！呢個就大問題出現啦。咁呢個咧係要好快咧，係快啲去搞掂呢個情況嘅。咁呢個你就要入 emergency 啦，入醫院嘅啦。OK， so the O2 saturation. What is O2 saturation? OK， 嗱，如果你睇醫生嘅時候咧，好多時咧佢就揾一隻夾住你，睇住你個 O2 你個 oxygen 係咪過咗90？如果你 O2 saturation 唔係過90，係80幾咧，咁可能咧你真係有嗰個病情係好大問題。咁佢一定要俾氧氣你啦，或者你真係要繼續要 observe 下係咪係俾氧你係咪個 O2 高翻上去啦。咁呢個咧尤其是老人家咧更加係要重要嘅。咁呢個 O2 saturation 咧係一個十分 good 嘅 indicator， 係幫助你咧係睇下你係個 gas exchange 得唔得，夠唔夠氧啊 ？OK。So the real question is O2 saturation is extremely good, indicator regarding your blood oxygen. Is it enough oxygen of your O2 oxygen in your blood cell doing work? If your O2 are not enough, like for example, lower than 90, then you have a real issue, because then the gas exchange might not be good. You are very sick. That's why your O2 saturation, especially when it comes to 85, is really you have to go to hospital to actually check this out. If you're under 90, it is an issue start coming along. So O2 saturation, the doctor will first come in with a clamp, take a finger, and they observe is your O2 saturation over 90. Normal people should be over 95 to 100. That is normal people. If you are sick, you may go down as low as 90, below 95. If you're below 90, you have an issue. If you're below 85, you have a real serious issue. You got to go to the hospital to look at. Now, a lot of people, I know in Hong Kong, some people are buying an O2 saturation monitor, to look at themselves. Especially older folks, you got to watch that, okay? And so another question is, how can I check if I wear my mask properly? And I think that's a very good question, Eugene. When you wear a mask, when you go out, you should go check yourself on a mirror. See that you have actually wear a mask, cover your nose. If you have not done that, then you are not going out to cover yourself a little more, safety for yourself. Cover your nose, cover your mouth. Your mask should not have your nose exposed. So that is very important. Now, 記住，如果你係 wear 個 mask 咧，一定要 cover 晒成個 nose。咁最好咧，你去街之前咧揾個鏡自己睇睇，咁你就知道係咪做晒呢啲嘢咯。呢度係應該 cover 晒咁多嘅地方嘅，OK？ So you should wear mask and then with the mirror, check it out. Do you cover everything? Okay. So another question is, what is the way to disinfect the surface? Now, there's a lot of so-called Clorox wipe. You can wipe on the surface. You can do that. A spray. Get good cloth sprays is actually very good. So wiping the surface is very important. So 依家好多時咧話台面係點做乾淨咧，好簡單。你揾啲 Clorox 嘅 wipe 啦，或者 spray 啦都 OK 嘅，幾樣都可以做到。咁你最緊要就係做到呢個 surface 乾淨就得㗎啦。So what do you mean no carb pill or syrup? Okay, as you know, the carb syrup, a lot of them has sugar in it. So you gotta bring the no sugar syrup or low sugar syrup. Now, if you have high sugar syrup because they want to get you taste good, the carbs is high. So you really has to have the syrup does not have a lot of carbohydrate, need a lot of sugar because it will absorb your blood sugar, okay? And then there's some pills, actually nowadays, because they want the pill to taste good. So they put some sugar in there. So there's a high carb sugar to make sure when you take the pill, you taste good, you swallow no problem. So those are pills that you need to check whether if you have those, maybe don't take those high carb because a little more carbs get in there is no good for you. Like syrup, carb syrup, you take usually about 4 cups, 10 ounce or 5 ounce. You have to take 5 ounces of sugar. That's not very good, right? So you got to be careful with that. 所以其實咧食咳藥水咧，好多人依家咳藥水係好甜嘅，因為佢係想令到你好食啲，容易食。咁又俾好甜嘅咳藥水你食。咁但係呢啲咧全部對你血糖唔 good 嘅，因為你係糖尿病者嘛。依家仲有啲藥咧令你容易吞，亦都係擺糖喺度，咁變咗亦都唔正仔。OK？ 咁另一個問題咧就係、What do you mean hypoglycemia effect and cold flu medication? Now, remember, 當你係remember when you have hypoglycemic, that means your blood sugars are low, very low. Now, could be because you take a lot of medication, your blood sugar is low, so you really have to have a sugar pill with you, especially when you're hypoglycemic, because I noticed. Actually, one of the clients was asking me, "Hey, after I've been isolated, I've been getting a flu. You know what? My hands started shaky. I started getting sweaty." I said, "You know what? Most likely, yes, you have been taking your medication, but you didn't eat a lot. Your blood sugar actually is dropping down. So you really have to watch your hypoglycemic. So I suggested you eat slight sugar pill." And then her symptom total relief, no more hand shaking, no more sweating. 嗱，其實當你有個呢個 flu 嘅時候，好多時咧你唔食嘢啦，咁你唔食嘢咧，你亦都食咗你嘅low sugar 食物啦，或者你嘅藥啦。個問題咧，好多時做咗呢樣嘅時候咧，你就變咗係個糖好低啦。咁啊，糖好低咧，第一個 sign symptom 咧就會手震啦。出冷汗啦，咁呢啲咧係要食翻一啲你嘅糖咧係幫助你嘅，咁所以變咗嚟講咧，呢個咧 其實好多時咧，我好多朋友咧，原來佢哋咧就係冇食嘢，但係又唔係飲水乜滯喎。咁變咗嚟講咧，佢真係咧又食咗藥咯喎，咁個糖咧係會降低嘅，即係會降低。咁你呢個咧就要知道呢嘅叫做 hypoglycemic，即係降到好低嘅血糖，好似3以下咧，你快啲食個糖片啊，令到你咧，如果冇糖片咧，就去食個餅乾、朱古力都 OK 嘅，但係令到你咧係快將個糖整高佢。OK， 咁令到佢唔會變咗係 hypoglycemic。如果唔係咧，你會暈咗嘅。OK。咁啊 ，How do you know your ketoacidosis？ 嗱 ，ketoacidosis 咧初期咧係唔會有症狀嘅，但係有症狀嘅時候，第一樣嘢知道咧就係會口腔裏邊咧係會有個fruity smell 啦，呢個好常見嘅，同埋咧有 shortness of breath 啦，仲有一個常見咧就係你個唔係水啊，一定會嘅，就係你個血糖好高，係300度或者呢個16度以上。OK， 咁你一定要知道呢樣嘢之後咧。咁即係話你知道咧，你會 end up 就快會 ketoacidosis 啦。So the most frequent sign and symptom in ketoacidosis is really your breath, your keto smell. Now, early sign has no symptom, but really, and when you pick a finger, you start seeing yourself as getting 16, 17, or 300 milligram per deal. So you know you are approaching there. So you really have to do some work. And after that, you're going to start getting fatigue, frequent urination, getting thirst, severe thirst. So at that time, you know you are moving into this really more serious ketoacidosis. So that you got to really go to the hospital real quick. Now, so the most important, measure your blood sugar, because the first sign of that before you get all the fruity smell, your blood sugar is approaching 16, 17. So you really got to bring it down. So remember, before you get sick or you getting that, drink a lot of low sugar tea. So hopefully that will continue to keep your blood sugar become low. So net result will be good for you. Okay. So now the sixth lifestyle. What is BMI? I know BMI is a difficult calculation yourself. So just go up to the website, go type down BMI calculation. So in relation to your weight and height, height is by cm and also by kg. So they will calculate for you. So make sure you know the height in cm and height in kg. They will calculate for you and you get your BMI. Now, BMI importantly is you should below 330, not below 40 alone. 30, because once you're over 30, you're obese. The best is you below 25, because you're over 25, you're actually overweight. So BMI will be very important to help you to understand where you're at. Are you overweight or not overweight? Now, one more thing.嗱 BMI 咧係好簡單嘅，因為個 calculation 咧係難啲啦。咁最好咧，你上網咧就睇 BMI calculation。咁你寫 BMI 咧，你網站彈出嚟咧，你有個 cm of the weight 啦，你個高度啦，你個 cm 嘅高度啊 ，cm 同埋你個 weight in kg。咁你咧兩樣嘢咧俾咗佢之後咧，佢就會同你自己計 BMI 啦。如果你 over BMI 31，即係話你嘅 obese 好肥胖。但係如果你過重咧係 over 25嘅，咁你記住要 under 25就 good thing。所以你盡量減咧，你只要減你個磅數咧，同埋你嘅 height 咧 under 25，咁你就會係 in a good stage 個 BMI 嘅。咁嗱，去到醫生嗰度啦，去醫生啦，咁我幾時先應該去醫生啊？有個 question 啊 ，When should I go to doctor？ 嗱，當你去叫醫生嘅時候咧，最緊要咧，如果你病，第一。你病，我有咳，有鼻塞，好唔舒服，發高燒，你應該係見醫生嘅。So 同埋你好多症狀，如果你真係開始有 shortness of breath 啦，更加就要去 emergency， 唔係醫生啦。OK， 所以其實咧見醫生咧，當你開始病嘅時候，最好咧就快出去有咳嗽啦，有發燒啦，有流鼻水啦。唞氣有少少困難，你已經開始見醫生，咁睇下係咪呢個你已經係若係你個 flu 啊，或者你係呢個 COVID-19 啦。咁呢個咧係要醫生睇你咧，係幫助你呢個減低你啲症狀嘅。So very important, you need to go to doctor to understand when you go to doctor. One, you don't feel well, you have fever, sometimes you have high fever or low, medium fever, but you still gotta see doctor because you have fever. Because when you have fever, that's mean you have some infection. And then your cough, sneeze, you might not COVID-19, but you might have flu. But you need to have that to really check it out. So you have to go to the doctor because you have diabetes. You have diabetes, you will really want to make sure your symptom and your sickness can be controlled. Don't over stress and over the make your body to go downhill. So that is very important. So when you go see doctor, make sure if you have fever, you have a cold symptom. Don't just say, stay home, I'll get better. Because you have diabetes, you're a different person. You're a normal person, maybe that's true, but your diabetes is not true. Or you're pre-diabetic, you should also still go to see doctor if you have fever, cough, have difficulty breathing. Definitely, you have to see doctor. So thank you very much. Sorry about today. We have slightly overrun my time, but we have a lot of good questions. Thanks, Eugene. Thank Anne, and thank many friends of your busy time on Saturday or your Friday night. Still listen to a webinar. I hope you can learn something about it. We can talk a little bit more in the future about vaccination. We're getting more information on that, so you can be updated. But for now, wear masks and wash hands, keep distant, because this virus will be there for till end of the year to next year. So you cannot let go all your protections. Okay? 嗱，記住多謝各位朋友，因為咧今日好高興咧，有好多人問咗好多不同 question 啦，尤其是 Ann Mark 啊、Eugene 啊，好多人都問到好嘅 question。咁今日咧，其實所有啲 question 咧都係十分好嘅，但係記住，依家我哋所有嘅糖友同埋前期患病者嘅糖友，我哋現在係真係咧喺呢個 COVID-19 咧係唔會走嘅。其實出年咧都會喺度，所以我一定要咧保護自己 ，wear 我哋嘅mask 啦，戴個 mask 啦，同埋咧洗手啦，同埋距離啦1.5米啦，呢個咧係最好辦法。咁當然啦，遲啲我哋有 vaccine 嘅時候，我再會同你解釋多啲啦。但係重要點，依家到今年年尾，出年咧，我哋都係要有3樣嘢 ：mask、洗手同埋 keep distance。多謝位 ，Thank you very much, everybody. Have a nice weekend. I appreciate you actually attend the webinar, and thank you again. And I'll see you soon. I'll see you next week. Bye bye.